The differences that are going on now between the two political parties in terms of how they would approach Medicare's future are very important for people to debate. They're very stark, they're quite clear, and if we had actually a rational discussion of it, then people might be able to make good choices instead of the scare tactics that both sides end up using. Medicare is a really important program for seniors. It now gives benefits in excess of $10,000 a year to older Americans and persons with disabilities. It is something that people view as essential to their retirement, to their situation if they're disabled. For people who are at the end of their lives or who are disabled and cannot work, there's very little flexibility in terms of what you can do if, for example, the costs of your care suddenly go up, or if you were denied certain services. You have a lot of limitations on how you can respond. And as a consequence, appropriately, I think people recognize that this is a very vulnerable population and one that needs a lot of protection. I think the conversation at the moment is very much around the issue of, do you think the federal government or private insurers will do a better job of controlling costs over time? It's a very basic philosophical difference, not very well informed by actual facts, much more on the basis of what you might call, or what I would call, a religious experience. The big picture idea that a lot of people talk about for Medicare reform is something that's referred to as premium support. That is, what you would do is tell all of the beneficiaries of the program, you must choose a private plan and enroll in that private plan. The federal government will give the insurance company a set amount of money on your behalf to help pay for the cost of that care. The most dramatic way that people talk about premium support is to put a limit on how much will be paid for each individual and to reduce how fast it will grow over time. That's great for the federal government and the federal budget because it means it's very predictable, it's under control. It's not so good for individuals if the price of insurance continues to rise as fast as it has, then individuals are paying more and more every year for the cost of their care. They're taking on all the risks and the federal government is off the hook, so to speak. There are other, what you might call, softer sides of premium support or softer types of premium support that would grow faster than a set amount that would be tied perhaps to the cost of health care spending. That would be more acceptable to a lot of people, but the problem is that wouldn't necessarily save any money to the federal government. It would only save money if private plans proved to be very efficient and can find new and unique ways of providing care. The second major way that people talk about reforming Medicare over time is to have the federal government become more active in delivery system reform. That is, to change the way that we pay hospitals and doctors. We've already done that to some extent in the Medicare program, but they would go further. The other way would be to find ways to coordinate care more effectively for individuals. First of all, Medicare is a large share of the federal budget. It's about 16% of the federal budget and growing larger all the time. The other reason I think it has become a campaign issue is because it is easy to demagogue the other side, and that's true if you're a Republican or a Democrat. You can take pieces of things that people have talked about doing or actually are doing and make it sound really scary and try to convince people that your approach is better or safer. It's also a very popular program. It's been very successful for its entire existence. It's probably the most popular federal program we have. And to suddenly say we have to change it makes a lot of people a little crazy.